now. Uh-oh, we lost Harry. Okay, well, I'll go ahead and just introduce Matt. And when Harry comes back, we'll introduce him as well. So Matt Gross is Assistant Secretary for Government Affairs at the NC Department of Health and Human Services. And thanks so much for joining us today for this discussion. We kind of wanted to just share your thoughts about the most recent COVID-19 related session that the General Assembly held, and then as well as anything you're hearing about what they might be working on in this upcoming session that is starting on May 18th, on Monday. So yeah, if you could just kind of run through some highlights of the recent session, and then also if you wanted to share any missed opportunities from that session,
sure.
We'd love to hear it.
Well, thanks for having me. Congratulations on the 18th birthday of the North Carolina Alliance for Health. I guess it can gamble now, so that's great. Looking at the last legislative session, I think it was certainly a decent session. It was absolutely encouraged to see the way that there was some bipartisanship, which I know is something that has been sadly lacking in this state for a while. The House, in particular, as I'm sure most of y'all were following, had a lot of open committee hearings. That was a really valuable process to see for engagement for stakeholders, to kind of see where their heads were. The Senate's process was a little more closed door and mysterious. I think there was some uncertainty heading into the session as to exactly where the Senate was going to be. Ultimately, was glad to see that all sides kind of came together to put forth a package that I think people can generally live with as a down payment on our COVID work. And I think down payment's really key, because we know that there's a long road ahead of us in terms of both the medical and the economic response we're going to need to address COVID-19. I know the legislature spent approximately half of the federal money that's been given to us thus far related to COVID-19, as they're awaiting further guidance on how the rest of the money can be spent. And I know even as they're looking ahead, they're trying to find a balance between where can they do expansions for COVID-related work, while also keeping an eye on the fact that revenues are going to be down this year. And what is that going to mean for the rest of business of state government? I know there was already a request from Senate budget chairs even before the last session for a voluntary 1% spending reduction across all state agencies. So that gives you a little sense of where the Senate's already starting to look. And I've heard rumblings about trying to figure out how much of the CARES money can go to plug holes, which aligns with a lot of the activities we saw during the 2008, 2009 recession, where a lot of the federal money was really used to plug holes, more so than new investments. I see from a policy standpoint, I think the session went pretty well. We have some reporting requirements we're trying to get in place so we can actually access the testing and tracing money that they gave us. Several of those requirements we're actually already doing, or we're in the process of getting online, but there's a few more that are some weedy data mining things we're going to have to develop and work with some of our partners to be able to pull that off and display it online. In terms of looking ahead to the next session, I think maybe Harry's crystal ball is a little clearer than mine, but it's been fairly foggy to me. Up to this point, the notion was that the House was planning to come back, do another really short, maybe 2-week COVID session, pass some other COVID bills, go home, come back in July and run a more traditional short session in July. As we all know, the tax filing deadlines were pushed out to July, so we won't have the revenue numbers until then. And then really do a traditional short session in July. That was the House, where the House has been posturing for the last week or so. The Senate has been more in a place of just come in, do the short session, knock out some sort of budget and go home for the year. The latest intel I'm hearing indicates the House might be leaning more in that Senate direction. And those of you who work at the General Assembly know, I take all these rumors and rumblings with a grain of salt, and frankly, these plans are evolving. I'll say, I know from the COVID response here at the state level, even still, the world I know on Monday is often very different from the world I know on Thursday. So I think that the General Assembly may have a plan today for how the rest of the year is going to shake out, and it just might truly genuinely evolve as they go through session and recognize that only so much can be done now, and there is a need to come back and do additional work. So I think it's a little unclear even what the structure of session is going to look like right now, in terms of whether it's just going to be short and then come back, or actually knock out the entire short session in the next 6-ish weeks and hopefully be done for the year in their minds. Again, I have a hard time seeing that actually work since we won't know the revenue numbers until July. I think the feds are working on additional spending packages, and I think that the needs are going to keep growing and evolving. So really, I think it's more likely that we might see some additional shorter sessions throughout the rest of the calendar year to address this ongoing crisis. It's sort of like being in a hurricane that we thought was going to be a Category 5. It's thus far been more like a Category 1, but it's still just churning on top of us. So it's not like it's cleared out. We know what we're dealing with. It's constantly evolving.
So I can add a little bit to that.
Yeah, Harry, let me introduce you real quick. So this is Harry Kaplan, Senior Advisor for State Government Relations with McGuireWoods Consulting, and also contract lobbyist, one of 2 phenomenal contract lobbyists with NC Alliance for Health.
I'm the less phenomenal one. Jeff couldn't be here today. Jeff's the taller, more phenomenal contract lobbyist. And he has more hair than I do. Anyway, that was a really good summary, Matt. The only thing I would add to what's happening right now and what we expect to happen in the next few weeks or months is that apparently next week, the House and Senate have agreed that their top priority is election law changes in order to be ready for the November election. It's a priority because they have to make some decisions and spend some additional money potentially immediately, if not sooner. And so they're likely to spend the next week on that, which may take a few days by itself. After that's anyone's guess. After that, the House is going to go home, as Matt said, for a month and a half, come back after July 4th or even in August once the revenue picture became a little clearer, allegedly, or hopefully. The Senate wants to just plow on through, as Matt said, and finish in 4 to 6 weeks and then come back in January. And the reason for that is because they're worried about if they pass another budget bill, that'll just get back to where they were before with the governor vetoing it, and then they're back to square one like they were before. So the Senate could, if the Senate's view holds, then they'll do some appropriations bills, but they'll be targeted, and they'll take care of some other issues that are left over from last year, but they wouldn't do an entirely new budget. If the House view prevails, and I think that Matt's right, I think the Senate's view is more likely to prevail, but if the House view prevails, they would do an entirely new budget for this fiscal year, which ends June 30th of 2021. What are the other issues? Well, there's Medicaid transformation from managed care, obviously, as Matt well knows. There's regulatory reform bill that was stuck last year that had a few things in it that the governor didn't like. They're working on a new version of that. And there are a number of other bills, as well as the additional COVID legislation. They didn't spend all the money with the last COVID legislation. There's still money there, but they're unclear as to how to use it. They're unclear on the federal guidance. They're waiting for more guidance about how they can use that money. And then we may have another appropriation from the federal government in COVID number 4, which is being discussed in Congress, and the House is going to vote on a bill probably Friday. So my personal guess is that they'll be in session the rest of the summer up until Labor Day, maybe, because there's just so much to do. Now, will that be continuously? I don't think so, but I think they'll be in and out for a while because there's so much to do and there's so much uncertainty. And as Matt says, it changes from a heck between now and Friday, heck between now and tomorrow it changes. It's ever evolving. But I do think election law is first on the agenda for next week. The other thing to mention is that if you want to go down to the legislature, and I can't imagine why you would, they are allowing the general public back in as of Monday. However, there are restrictions on that. You're not allowed to hang around or congregate in the hallways or in the quads. Paul Coble, who runs the Legislative Services Office, took out all the chairs in the Legislative Office building last year, or most of them. I expect all the tables and chairs are gone in the Legislative building now, too.
But Harry, will he ever put them back is the question.
No, I think no. That I think once they're all gone, we'll all be, yeah. Anyway, I think that if you want to go over there, you have to have a specific reason. You have to have a meeting that you have to have, or the legislators called you in for, and you go in and you go out. As far as the committee meetings go, my understanding is that there'll be 50% capacity, and lobbyists may not be allowed in at all unless we are testifying. So I don't think there'll be a lot of people down there, at least in the short run. Now, if the session runs until Labor Day, as conditions hopefully improve, there may be a relaxation of all this and we'll be able to go. The other thing is you'll get a temperature check when you go in the first time you go in at any given day. Get a little sticker that says you're okay for that day. And masks are going to be required, from what I heard. Now, again, as time goes on, all this may change and it may get easier, and I may go down there. But right now, I'm not planning on going down there. So anyway.
Let me add one other thing, I think, into the conversation. Harry, you brought up Medicaid transformation, and I do think that's going to end up being a topic that gets discussed somewhat thoroughly when they come back. I know the managed care plans are antsy to get that off the ground and running. It's already behind the schedule. I think folks were anticipating it being on because we couldn't get to a budget agreement this past year around, just a broad-based budget agreement. I think that situation is going to be further complicated than it was a year ago. I know when we look at managed care, one of the intended designs of managed care is to move care out of hospital settings into primary care doctors and to create medical homes for folks, which is absolutely where we want to be. That makes complete and total sense from a healthcare standpoint. You want folks to get preventative care. You want folks to be healthier for providing health care, not just sick care. You know, the emergency room is the most expensive place you can provide care. Another change with that, maybe folks on the call are familiar with this, maybe they're not. And on the federal rules, when you go to managed care, you also cannot provide supplemental payments to hospitals, which is a lump sum of money they're used to having from an operating standpoint. And it turns into where we try to put that money in the rate, how much they get paid really fluctuates by who walks through the door. So really what I'm trying to get with all that is we know that managed care was always going to end up being a money loser for hospitals, although that's not a reason to not do it. But the financial picture for hospitals has been strained significantly through the through all the COVID-19 work. Yeah, I know they lost a lot of revenue when they're having to stop non-emergency surgeries to prevent or to preserve PPE. They're at operating losses like a lot of businesses are. So the margins that I know we were banking on them having to help cushion as we went to managed care aren't there. And so one of the other big issues that is going to be an issue, and it's been an issue, is Medicaid expansion. And I recognize that there are still some political dynamics that exist in some of the leadership and some of the chambers over the General Assembly that don't have an interest for that discussion. But as we look at managed care more than ever, if we're going to be taking people out of hospitals that have payment sources and then leaving all of the uninsured people still going to hospitals, I think that's going to create an unworkable financial situation, and we need to continue to seriously have a conversation about where does expansion play in all this, because it's critical to provide people services. We know there's a lot more folks that unfortunately have fallen into the coverage gap as we've gone through COVID-19. Frankly, I think it's going to be a really key part of North Carolina's economic recovery. There's not going to be a silver bullet for economic recovery, but it's going to be a piece of it. You know, we've got over $4 billion worth of money sitting on the federal level that should be getting injected into our healthcare system. We got to figure out how to draw it down here. And when I think about other businesses that are going to be looking for support as they try to rebuild, it's not helpful to have general fund money going to pay for causes that could be getting paid for by federal money. So expansion is going to be a hot topic to be discussed as well. Where it all lands, I don't know. But where I know last session there was, I think, some frustration from folks that there was a notion that expansion and transformation were getting tied together. I think what we've seen happen over the last year, or not last year, last just 3 months from a financial situation, reinforces why there is a connection between the two from a hospital sustainability standpoint. So that's just another topic that's going to be another ingredient to add to the soup at the legislature.
Thanks. I want to ask some follow-up questions about the topics, actually. So we've talked about transformation and expansion. You know, a couple of things that the Alliance and our partners have been working on recently are really food-focused topics for the most part. Talking about school nutrition and support for the food banks and access to SNAP and WIC. Are either of you guys hearing anything about the potential for more funding to be put into any of those areas?
So I think maybe the food banks, and thanks to Matt and the department, they've been tremendously supportive. And of course, the food banks get their money through the department, and the $6 million additional dollars in the COVID legislation goes through the department. I know they're working to figure that out, how to get that implemented and out to the food banks. The food banks, I'll just give you an example of the dire situation. The Food Bank of Central and Eastern North Carolina, which is the biggest one, covers the biggest area, about 34 counties. They're burning through an extra $1 million a month. They're spending as a whole. Food banks are spending, the 6 food banks in the state are spending 10 times as much every month on food and food distribution as they do normally. Now they've gotten this infusion of money from the General Assembly that's going to be coming through DHHS soon. They have their regular money, recurring money, which they'll get beginning in August. They have a couple of grants they've gotten recently, and donations have been good. Really, the problem is going to be in about 6 months when things have died down, hopefully a little bit. But the needs are still going to be there, or the economy is still going to be in pretty bad shape. Hopefully, a lot better than today, but still recovering, and people still are going to be in need. And so, the continuing need for help for the food banks will be there. So I assume, I don't think they're going to ask for any more money right now, but I think it's going to be a request in the future, near future. As far as child nutrition goes, same thing. I think the need is just extreme, especially with the way the schools have been hurt and the usual distribution channels have been shut down. This past budget gave a good infusion of money into that, but I think the need's still going to be there. I don't think there'll be an immediate additional infusion of money in either place, but I think it's coming. And again, as we get more money from the federal government and as we get more direction on the money we've already received, that may free up some additional resources for those things and other things as well as for the hospitals, as Matt was talking about earlier, because at the very least, they're going to have to come up with some more money to help the hospitals too. So,
yeah, I agree with everything that Harry said. I would add to it. I was really pleased to see that the final COVID package had money for not only the food banks and our other food and shelter efforts, but also the money for the school nutrition program. There were a few versions floating that didn't have those funds quite as full as others. So I was really glad that the final packages were pretty close to what the governor had proposed for funding those areas. I think another question as we head into the fall is, what does the school calendar look like? And how are school services going to be delivered to students this fall? Because where they've done a good job setting up the summer feeding sites in immediate response to COVID, there's going to be, and they've been trying to do distance learning. All of that work is going to be tied together. So I think there's still a lot of question marks as to just how that's going to run and what funding is going to be necessary to stand that up. But food security remains a huge area of concern. I know we've applied for every possible waiver we have the ability to apply for. I know there's some we're not given the flexibility to apply for. If there's a waiver we could apply for, we could do it. I know we've gotten an additional 800,000 people served through the PEBT program, the pandemic EBT program. That funding has gone out. I'd be curious to see if the feds create more of that. And then the other thing, just to add another layer of complication, all this in the food space, is they're calling for a more active than usual hurricane season. So as I sit here at the Emergency Operations Center, which is usually teaming with folks for hurricane response, there's been a lot of conversations about what are we going to do if or when a hurricane hits the middle of all this, which I certainly do not want to see that happen. But we know when there's hurricanes, that opens up other sources such as disaster SNAP, or the DSNAP program, which we applied for this time around. The feds decided not to do disaster SNAP for the pandemic response, we did the PEBT instead. But continuing to look at all available resources. Food security is going to remain, I think, a huge challenge. And there's also the question of how can we continue to link up the philanthropic community that has an interest in this to folks that can get food out the door. We know that there are disruptions in the supply chain, which have created, in some cases, excess supply. I know that it's not as easy as it sounds because it's often a processing issue and not just a food that can be eaten is getting thrown away. It's really more in the raw product place, but other opportunities to figure out how to link up excess food supply into some of the folks that can actually serve the public. I know there's people looking at that and working on that, but it's not as easy as it sounds. And there's been some small success stories, but that's another place to keep looking. And so we've been also really good partners with the Department of Agriculture through all of this, and working with them in the food security space.
Thank you, and thank you to you both for everything that y'all are doing now, and specifically to make sure that the funding for those programs was included in the recovery package. I know that you both played a big role in that, and we appreciate it. And just, Matt, just to clarify, so for folks on the phone who may not know, the PEBT is Pandemic EBT, which is the benefits that are going to any student who qualifies for free or reduced price lunch in North Carolina. They're having funding added to an EBT card for their families so that they can purchase groceries and food.
Correct. I'd say the one caveat to that is it's unfortunately not everyone who qualifies, or everyone who qualifies and attends a school that runs the program. We know that there are some people in the state that would qualify but don't attend a school that has the program. That is not our call. That is a USDA call on that policy. I've gotten some questions about why that is, but that decision was out of our hands. But we do know that there are some families that are slipping through the cracks because of the way that was designed from the federal level.
Yeah, well, I've also heard, on the other hand, that it really is helping a lot of families as well. And we're hearing reports from food pantries that, the number of families that are showing up for support has decreased since PEBT started being dispersed. So.
That's great to hear. Yeah, no, definitely much more good than harm from that. I just wanted to acknowledge that there is that little loophole, because I've also heard some folks that have slipped through those cracks and they're frustrated, and I understand why. But yes, no, definitely been a great program, and I'm glad to hear that the folks providing food in the community are seeing the impact firsthand, because that's always the best litmus test.
Absolutely. So I actually wanted to go back to something that, Harry, you mentioned a little while ago too, about the fact that they're going to be opening up the General Assembly building to people who wish to go down and lobby. And I was actually just wondering if you guys could talk a little bit about how the lobbying experience has been different during this time, and maybe some comparisons between, what it looked like last session, being able to be down and be in the building and run from meeting to meeting and room to room, versus now kind of what, how are you operating? How are you doing that? And, what tools are you utilizing?
Well, oddly enough, I think I may be more effective if I'm not there. But no, it's been challenging. I think it'll be increasingly challenging as the summer wears on. And I don't think a lot of lobbyists are going to be going down to the legislative building in the next few weeks. I think, as I said earlier, as the summer wears on and things improve, you may see more people down there. But right now, the rules are such that they really aren't encouraging you to do that unless you absolutely have to be down there. What I've been doing is what I'm doing today. I'm actually at the office. There's nobody here, so I get a lot done. And my wife was like, "Yeah, go to the office." After 6 weeks at home, she agreed. But I've been down here the last 2 weeks working, getting a lot of work done. There's nobody here, and we have a big open office, so it's with good ventilation and all that. But I've been making a lot of phone calls, a lot of calls like this, and a lot of calls without video, and a lot of text messaging and a lot of emailing. It's been, and also watching a lot of meetings using, the video and audio services. The technology of the General Assembly has gradually gotten better and better. It still has its glitches, but it's pretty good. And interestingly, you can get legislators. Some legislators prefer a phone call, others prefer a text message, others prefer an email. You figure out which ones have which preferences. We have one of our House Appropriations chairs who famously is most accessible by text message. And if you try any other way to access this person, you just don't get them very well. But by text message, very responsive. So once you know that, that's how you do it. And so we're sending a lot of documents, having a lot of phone calls, and doing a lot of things, virtually and through technology. It's a little disconcerting because, lobbying is a relationship business, and being able to sit with someone, being able to, walk around and joke around. And I also envision people standing on the bridge between the legislative building and the legislative office building and just trying to grab legislators and other people as they go from building in between the buildings. I don't think that would be too popular if you're trying to do that right now. But, I think as time goes on, people are going to want to see people. It's a relationship business. So it's a little bit challenging not to be able to. And also, Matt and I have a lot of good friends down there, legislators, staff, others, lobbyists. We're lobbying community as a family. It's a dysfunctional family a lot of times, but it's a family. And so we enjoy seeing each other. It's the best. I've loved this job every day, almost every day for 32 years now. And the biggest reason for that is because of all the friendships and relationships, and, I've developed over the years. The fun of working with people, and so it's like our kids who haven't been able to see their playmates and classmates since March. It's a psychological hurdle. It can become a problem especially if I worry about our children not having that interaction with their peers and with their friends, and we're older and we can deal with it better, but still it's difficult not to be able to. Yeah, I haven't even seen my colleagues in McGuireWoods Consulting very much. We do a Zoom happy hour every Thursday afternoon at 5:00 just to joke around and talk and have a beer and talk to each other. And that's been really fun, but it still doesn't, it's not good. It's not a perfect substitute for, obviously being in person. So.
Matt, did you have anything to add?
No, I think Harry really covered it. I certainly agree. It'll be interesting to see how the session functions. I think the COVID session in some ways was a little easier to manage remotely because the focus was narrower. Even though there was a lot of work done and COVID touches lots of parts of state government, it was still relatively narrow compared to the great body of work that tends to go on down there. As we know, the pace is really fast, is often fast at which bills are moving. So be interested to see how it works. I think part of what made it work really well in the COVID session was there was a lot of bipartisan work. I think that was really, really helpful because folks were on the same page and all generally rowing in the same direction, which is something we don't see as often in a lot of the political and policy work that's going on. So I think that the more we get to business as usual, the more that in-person interaction is going to be important, but balancing that with the risk is certainly a concern that we have. I mean, I personally worry about not only this family Harry talks about. I think we all care about each other and want to stay safe. And when you look at the General Assembly, we know that 52% of North Carolinians have a risk factor that would lead to a potentially worse or deadly COVID-19 outcome. And I bet the percentage in the General Assembly is higher than 52%, given that a lot of this is based on age and other underlying health conditions. So, and I certainly worry about the health and safety of not only the legislators, but also the lobbyists and everybody. So I think we're all trying to find that right balance of how do we function effectively? How do we maintain our relationships, but also protect each other? And so sometimes there's a push and pull against those priorities.
Yeah, definitely a balancing act. And yeah, I definitely, understand that it's important to, you can sometimes be more effective being in person, but we also absolutely want to be, cognizant of the reason that we're all being asked to stay home right now is to protect ourselves and each other. So it's a balance. So I'll open up.
I've not done this long about eating at the Daily Planet in God knows how long.
You missed that?
And the Vegetarian, right?
So I'll open it up just for any final thoughts from either of you about last session, upcoming session, and then we're going to do a couple Q&A questions if you guys still have a couple minutes for that.
I'm good.
I would just say, again, I was really encouraged with the way last session went. I know one of the things Harry touched on early on was, last year was a really difficult session. I don't think any of us like being in the place where we're living in the land of vetoes. I mean, I know I'm personally drawn to this work to find compromise and a path forward and to improve people's lives. I think that's why we're all drawn to this. I hope that some of the spirit from the COVID session can continue when they come back. I think it would all be our preference to continue to look at, budget packages that can help address critical needs as we continue to move through this crisis that really is going to be ongoing and with us for quite some time. It'll be interesting to see how the next few weeks and months and the rest of the year really play out. I think we do our best work when we work together. We've seen that with the hurricane sessions. We saw it with the COVID session. I realize that this being an election year sometimes makes that difficult because there are other items on people's minds, but I hope that we can keep some of that spirit, because I was really encouraged with what we were able to accomplish a couple weeks ago.
I absolutely agree. So we're going to do a couple questions, and I'll just throw these out for either of you. So the first is, how should we view the Senate's reluctance to fund treatment in addition to testing for the uninsured?
So let me take that one first, actually, and I will give the Senate I will give them a little bit of a pass on this one. So maybe this is speaking to an item that I know the House took up and passed, and we were really pleased the House passed it. The Senate didn't take up, and that was an expansion of Medicaid to 200% of federal poverty to pay for testing and treatment of folks that have COVID-19. So that's something we put forward in an 1115 Medicaid waiver to the feds. And in constant conversation with the feds that was actually ongoing concurrent with the session, it became clear that, well, they told us, we're not saying no to your request, we're saying not yet. And then also as that was going on, the Fed simultaneously announced that they're going to fund testing and treatment for the uninsured populations for COVID-19 through funds that are going to be distributed through HRSA, which is still a little perplexing to us, just from the standpoint that if the feds are going to pay for testing and treatment money, it would seem to make a lot more sense to pump that out through the Medicare system, since that's actually I never heard it described this way, but Secretary Cohen used to work at CMS, said it's the largest health insurance entity in the world, and I bet by numbers that's accurate. So it was a little surprising to me they're going to build a separate infrastructure to pay providers, and it's unclear what the rates will be or the reimbursement structure, how much money's there. But that led to, if the feds have already said, like, we're not going to approve your waiver to go up to 200% of federal poverty at this point in time, because we expect to use the HRSA money, it made sense to focus on that. Also, with the General Assembly only using federal dollars in the relief package, we can't use federal dollars to draw down additional federal Medicaid dollars. So it didn't really make sense to put that in a Medicaid line item where we're essentially spending state dollars with no federal match. We'd essentially be spending the money with no federal match. So that was a bit of an ongoing development. I wouldn't necessarily classify the Senate as not wanting to give the uninsured access to care as it was COVID-19 related. I think there's a whole separate conversation about the role we see Medicaid expansion playing in the path forward. But I say for this past session, I would view it more as a shifting of philosophy that we were all doing jointly as we saw what the feds were and weren't allowing, what the feds are and are not funding. But happy to see if Harry has any more to add.
No, I think that covers it really well. Thanks, Matt.
Thanks, Matt. The next question is, NC's public charitable clinics are struggling to get enough PPE. Is there any policy or program from one of the state agencies that would help with this?
Sure, so happy to take that one as well. So if you know of any charitable clinics that are struggling, first thing is they should reach out to their county emergency manager. The PPE distribution that we're running at the state level is running out through the county emergency management system, much like what happens with hurricanes. Unfortunately, there's a global PPE shortage. I don't have the latest numbers on where we stand, but I know as of at least about a week or so ago, we had over $200 million worth of bids for PPE out there and had received just a little over 5%, except PPE and medical supplies, and had received a little over 5%. Now, where I think the numbers that we're receiving are starting to increase some, unfortunately, we're getting more out to folks. We've had to focus, of course, on those frontline emergency medical workers so we don't have them go down. And then want to build out to other healthcare workers, make sure we're also having first responders get access to PPE, EMS workers. Getting PPE into congregate care settings is a huge priority right now as we continue to see there be more spread in those settings, which can be such a just a tragic situation because those are filled with folks that have risk factors. So PPE requests should be done through the county emergency manager and then through our system. A few other avenues that will be opening up. I know that they're in the process of certifying the budget that was passed a week and a half ago to get money out the door, but they gave additional funding specifically to the North Carolina Healthcare Association, the Medical Society, and one of the adult care societies. I'm blanking on which one. So they're going to be getting state money to pay for PPE, but I have no idea how those entities are going to get it out the door. But you can definitely reach out to your county emergency manager. Our goal is to get folks typically up to a 7-day supply when we can. It's not really much beyond that because of what we have in the system, but we have vetted over 800 PPE vendors. And I'll say one of the other challenges with PPE is once this started, PPE turned into this weird, almost black market currency where everybody was coming out of the woodwork who knew a guy that had a connection to 1 million masks in some other country. And some of these calls I was involved in almost felt like drug deals. And sadly, more often than not, the shipments would fail to materialize, the orders would get canceled unless at the last minute. 1 million masks would turn into 50,000 masks, or even in a few cases, we would get counterfeit products that we would return and report the vendor to the Attorney General. So it's been a bit of a quagmire to work through because the traditional PPE vendors have just been struggling to get it there, but it's moving in the right direction. But yeah, long story longer, I guess, reach out to the county emergency manager.
The next question is, and I think we might have touched on this a little bit, but is there an across-the-board Medicaid budget reduction, and will the department have the authority to apply those cuts, or do you expect the General Assembly to recommend areas for reductions?
So I'd say, well, I never like operating under a continuing resolution and no budget. Probably one of the best things that happened with there out being a budget and the override seeming to be taken off the table is we didn't get the $42 million cut to the Medicaid staff, which would have been utterly devastating even under the best of times. And just, I think, completely unworkable. I mean, the cut would have gone to fit a little bit down the road. We'd be looking at a $21 million staff reduction in like a month and a half if that budget were in place. So I'm glad that we're not facing that right now. Since there has not been a budget passed, there are no funding reductions. We're still running off the CR, which is the funding levels from fiscal year 2018 and 19. So we don't have any cuts in the Medicaid space yet. And there's a question of what enrollment growth is going to look like. I think we're going to be needing, we didn't get a rebase last year. I'm going to get a little technical for a second. Part of why we've been able to do okay with the Medicaid program thus far is when we go to managed care, you're paying in advance. Well, we're still also paying for fee-for-service in arrears. So last year's Medicaid budget was going to be a funky one and a larger one because we're going to be simultaneously paying ahead as the managed care plans came on live, while also paying behind on the fee-for-service program, which is actually going to be a phenomenon you see over the first 5 years of managed care as we slowly transition populations, and some will always stay in fee-for-service. So the Medicaid budget last year had a lot more money than it needed. Frankly, by not launching managed care in this fiscal year, there was a cost savings because we never had to do the pay forward. We could direct it all into the pay backwards. So the Medicaid budget for this current fiscal year is good, but the Medicaid budget looking ahead to next year, there'll need to be a somewhat noticeable rebase. I don't have a solid number on that yet. I know the Medicaid team is working on it just to address the enhanced growth within the program that we've seen. But fortunately, there is no staffing cut to Medicaid at this time, and I hope that remains the case.
So touching on the cost savings that you were talking about, has there been any discussion that those would be applied to help launch Medicaid transformation?
So there's a lot of work and a lot of funding and a lot of policy that we needed to launch Medicaid transformation. There's money sitting in some reserves that are used to launch. So the little bit that may have been achieved through utilization savings is really nothing that's going to come close to being able to get managed care off the ground. We're also trying to figure out what within the utilization patterns that have changed within hospitals who've been serving these folks need to potentially be adjusted to just address the current need that's out there from a funding standpoint. So unfortunately, no, that's not really going to be a pot that I think is going to make a big difference on that front.
Okay, I think that is all of the questions that I'm seeing that have come in. Again, just really appreciate all of both of you, your willingness to have this conversation with us this afternoon, and all of the work that you are doing for the state of North Carolina. We just really appreciate it. For everyone who's listening, thank you so much for attending. We appreciate your time as well. And we'll be sending out the recording in a few days with some follow-up information. And then, of course, in the meantime, feel free to contact me at morgan@ncallianceforhelp.org with any additional questions that you might have, and we will see if we can get those answered. But Matt, thank you. Harry, thank you. We appreciate it. Stay well, and I'll talk to both of you soon, and maybe we can grab lunch at the Daily Planet in the not too distant future.
Thanks very much for having us.
Thanks.
Good to see you, Matt. Thanks,
You too, Harry.
Yeah, bye.